So I was reading through the newspaper the other day, and I came upon a caption in a want ad, and it read, "Man with coronavirus seeks woman with Lyme disease." Now what if I told you that laughing at a silly joke like that did more than make you smile and make some kind of weird noise, that it actually affected your health? We all laugh, and I guarantee we would all laugh if I threw a pie in Mr. Butler's face right now. But lucky for him, this class is online now. Because we all laugh, I feel like it's very important that we all listen to what we're going to talk about today. Today we're going to talk about some of the pros and cons of laughter and how laughter can affect our health. Now, I've researched and I've studied this topic in order to be best prepared for today's presentation. First, we're going to talk about how laughter affects our physical health. Next, we're going to talk about how laughter affects our emotional health. And finally, we're going to talk about how laughter affects our mental health. Now that we've been given a brief preview of what we're going to talk about today, let's go ahead and jump into how laughter affects our physical health. According to Sahakian and Frischman, laughter can affect our cardiovascular system. That's our heart system, how our heart pumps blood throughout our body. They tell us that upon laughter, due to all of the muscles that are engaged and contracted, that our blood flow can increase upwards of 22% above normal. Sahakian and Frischman also tell us that our respiratory system, our breathing system, can be affected by laughter, particularly patients with asthma. They tell us that laughter can cause asthmatic symptoms to become worse and actually make the condition itself worse. And there's another example of a physical effect that laughter can have on us. One that you might not think about right off the bat. And that is involuntary loss of muscle control. That's right. During prolonged sessions of laughter, you can actually lose muscle control. Specifically, the muscles that control your bladder. Talk about embarrassing. Now that we've talked a little bit about some of the physical effects of laughter, let's go ahead and jump into some of the effects that laughter can have on our emotional health. Bennett, Rosenberg, and McCann tell us that laughter can act as a stress reliever and allow us to relax. This can result in us not taking life so seriously and let us enjoy our everyday lives and what's going on around us. Brazil tells us in her article, Using Humor in Our Everyday Lives, that laughter can give us a playful and positive attitude. And we can use laughter to spread cheer and happiness to our coworkers, our friends, or our fellow classmates. Brazil also reminds us that laughter is not always a good thing. She tells us and reminds us that what I think is funny, my wife might take offense to. This is particularly dealing with jokes about religion or someone's body type, things of that nature. And those would definitely have a negative effect on someone's emotional health. Now that we've talked a little bit about laughter's effect on emotional health, let's go ahead and talk about laughter's effect on our mental health. It seems, according to Brazil, that laughter can offer a type of separation from reality. When I was involved with my time in the fire service, my coworkers and I, we used laughter a lot. It was a way of dealing with some of the stresses that we came upon doing our job. And it was a way that we could laugh off some of the more difficult experiences that we had eating away at our minds. Bennett et al. Tells us that laughter can also act as a type of placebo. Due to all of the positive endorphins rushing through our body that are a byproduct of laughter, it can actually lessen our physical pain, make us feel that we are more comfortable than we actually are, and lower our level of anxiety in some patients. Talk about a mind trick. That is amazing. Unfortunately, we can see upon looking at Roach's article that laughter is not always the best medicine for our mental health. Roach did a study on professional comedians, particularly in the ages of deaths of professional comedians versus other people in the entertainment industry. And he discovered that on average, professional comedians died at a much younger age than other colleagues in the entertainment industry. Perhaps this is due to the comedians using laughter as a type of disguise or a front to keep people from really seeing what's going on inside their head. Now that we've talked a little bit about mental health, let's go ahead and wrap things up and review what we've talked about today. Today we talked about some of the pros and cons of laughter. We talked about how laughter affects our physical health, our emotional health, and our mental health. And I think after today, we can all agree that laughing is not a joking matter.